Welcome to this episode of Black Family Doctor, Real Talk About Health and Life. I'm Dr. Aisha Harris, and this episode is about opioid use disorders. Now, this episode's quote is, "No one is immune from addiction. It afflicts people of all ages, races, classes, and professions," by Patrick J. Kennedy. Now, you may be wondering why you're listening to this episode. The first few episodes of the second season of the Black Family Doctor podcast have been on substance use disorder. I started this way because as a primary care physician, I have a lot, almost daily, conversations that are pretty uncomfortable for patients to speak about and inappropriate in society. Just like high blood pressure, ACL tears, substance use disorders are medical problems and require attention, and in many cases have recommended treatments to prevent additional problems and complications in the future. What do you think of when you think of addiction? When you hear someone has had an overdose? Why do you think that happens? Oftentimes, when people think of addiction, they think of overdosing or some form of intoxication. They think of excess and poor control. Addiction looks differently on different people, but oftentimes the context that addiction is spoken in doesn't give the full picture of it being a medical disorder that can be treated. Drug overdoses are the leading cause of injury-related deaths in the United States. That means they're preventable. When opioid use disorder is depicted in movies, pictures, news, it's mostly at the end of the spectrum. It's sometimes even at the end of life. And so we get a small glimpse of that final struggle, not necessarily the struggle or challenges that someone faced over the years. Opioid use disorder isn't that clear sometimes. Sometimes it's hidden in plain sight in our neighbors, friends, family, and sometimes even ourselves. Illegal drugs have been around a long time. And when it comes to legal or prescription drugs, we know that there are common side effects. And one of those side effects is what sparked the opioid crisis. In the 1990s, the digital world was still in its infancy. So I can't imagine what the opioid crisis would have looked like if we were in our current times, when the entire world is connected from one click. But in the 1990s, between the evidence that opioids helped chronic pain and the aggressive advertisement from pharmaceutical companies, opioid prescriptions were on the rise significantly. And that was a problem. The desire for this country to treat pain, the fifth vital sign, more effectively increased the number of opioid prescriptions. That in turn increased the number of opioid complications, overdoses, and even diversions. And that was the beginning of the opioid crisis. It got messy. Addiction and dependence happened really fast. Eventually, people took notice of the deaths and overdoses, and more restrictions were set in place and created. Then heroin use was on the rise, gaining more popularity in the early 2000s, and it continued to grow. It was easy to access and even cheaper than opioids. So many people with dependence or addiction said, why not? So now there are different streams of getting access to prescription opioids and heroin in this country. And we were in a really, really tight bind. Because part of the problem was that the people who could help the opioid crisis were also the people who contributed to it. The health community and the fifth vital sign of pain campaign created a problem that was worse than and more deadly than the HIV and AIDS epidemic. Eventually, there was a push to be less lenient with prescribing of opioids, to decrease the number of available drugs in the community, and the whole fifth vital sign of pain that increased the need for improvement to treat pain now became a trigger word for wondering if a patient's pain was actually true pain or if they were just seeking a pain medication due to an addiction. Despite popular beliefs, the opioid epidemic isn't a black problem. It's actually more common in the white population of the United States. Part of that is likely due to this country's dark and not so distant, aka still happening today, history of undermining black people's pain, and for some reason believing that black people felt no pain or had a ridiculously higher tolerance of pain. Race is not a factor in the ability to tolerate or feel pain, just to be clear. Now, back to the general opioid crisis and the current challenge. Synthetic opioids are stronger and more dangerous than prescription opioids and heroin ever were. That's the new problem, or I'll say stacking onto the old problem, because we're still in the opioid crisis. We're doing better, but we're still in it. Synthetic opioids have taken their place in history and are testing our society's ability to gain better control over the crisis in general. Now, small steps have been made, like the Purdue Pharmaceutical Company pleading guilty to an $8 billion lawsuit for their role in aggressively marketing and advertising their prescription opioids, and the Department of Health and Human Services providing better physician prescribing access to buprenorphine, which is a medication that can help treat opioid use disorder, whether due to prescription opioids or heroin. Because technically, it's easier to prescribe opioids as a doctor than it is to prescribe medication that can treat an opioid use disorder, which is very interesting when you think of what is best for a patient and their longevity. Opioid use disorder is a medical problem. Addiction and dependence on various substances can take its toll on someone's relationship and their life. Almost 71,000 people died from drug overdoses in 2019, and over 70% of those were due to opioids such as prescription opioids, heroin, or synthetic opioids like fentanyl. In 2018, there were 2,599 deaths from drug overdoses in Michigan, with 78% being caused by opioids. And remember, drug overdoses are the leading cause of injury-related deaths in the United States. That means they're preventable. They don't have to happen. So why should you care? Because like I said before, opioid use-related deaths can be prevented. Because carrying around the stereotypical movie depiction of an addict or a person with a substance use disorder may cause you to miss opioid use disorder right next to you or in front of you. Because chronic opioid use, whether prescription or not, can increase someone's risk of death, respiratory depression, or dangerously shallow breathing. Because the desired relief from prescription opioids can lead to excess use, transitioning to heroin, or even experimenting with synthetic opioids, which all can increase someone's risk of complications and death. Because the anger, frustration, and debilitation of dependence that comes from opioid use disorder sometimes doesn't always look like what you would see in the movies. It's also next door and down the street. It's at your kid's soccer game and local grocery store. It's not as far away as you think, with millions of people in the United States being addicted to opioids in this current time. Opioid use disorder is anywhere. Overdoses can happen at any time. Many health facilities take in overdose patients with no questions asked. Many pharmacies and organizations even have programs where they'll give away Narcan without a prescription, because Narcan can be used by anyone in the community to reverse opioid overdoses. Like high blood pressure, opioid use disorders can be treated, from medications that help with the cravings and euphoria to therapy and other supportive resources. There are options. So the next time you think of your addiction stereotype, take a step back and imagine someone you know could possibly have a substance use disorder, and you don't even know it. Step back and be an advocate for healthy access and care. Realize that all medical problems have the right to be treated, and good health access and evidence-based medicine can help prevent complications like overdoses and even decrease dependence in general. Thank you for listening to this episode of Black Family Doctor Real Talk about health and life. I'm Dr. Aisha Harris, and this episode was about opioid use disorders. I encourage everyone to learn more about opioid use disorders, as well as consider carrying around Narcan in your purses, your bags, your home, or even your car. Remember that we're still in the opioid crisis, that we're still trying to combat the overdoses that could be prevented, because drug overdoses are the leading cause of injury-related deaths in the United States. This episode's quote was, "No one is immune from addiction. It afflicts people of all ages, races, classes, and professions." From Patrick J. Kendi.